I am Dr. Joe Greco, coming to you from Sarasota, Florida, and Greco Medical Group. We specialize in regenerative cellular-based medicine. I'm also the clinical director for Origin Biosciences, a company specializing in growth factor stem cells, and you're watching Plastic Surgery Live.
I'm 34 years old and I'm trying to research some procedures, and it's just so hard to get good information out there. And you're here and you're telling the truth and telling it like it is, and I just really appreciate it.
Well, I would suggest to patients, there would be a few major questions that I would ask a doctor who is utilizing cellular therapy. First of all, a lot of plastic surgeons have been using cellular therapy in surgery for years, and those surgeons that have been doing that have a good understanding, and and they're gonna explain things to the patients. But what I would suggest for patients to ask is, number one, how long have you been doing this procedure? Number two, what is the PRP system? What is the system that you are using to prepare the growth factors? Is it FDA approved? Is it a closed system? In other words, is there closed systems, there are no breaks in sterility. And all of the FDA approved systems are closed systems.
Well, let me ask you this. I mean, how many non-FDA approved systems are on the market right now?
Unfortunately, it's human nature that people want to take shortcuts.
Right.
You know, you really, it's strictly regulated as far as if you want to utilize autologous cellular therapy and PRP, you need to be using an FDA-approved system. If you are not, that's an issue. I don't think anyone doing this should be using a non-FDA approved system. So it's very easy, and all you have to do is say, what is the system, and you can check to see if it's FDA approved or not. The other thing I would also stress, I would ask the doctor to explain how it works. You know, if you're going for skin rejuvenation, if you're going for hair restoration, whether it's surgical or non-surgical, explain to me how it works. If they can't explain it to you, you know, that's a red flag.
Yeah, but these guys always end up explaining things in extremely simple terms. And
yes.
we spoke about that before. And, you know, there's the basics that you see on everyone's website about PRP. And then there's what you know, Dr. Greco,
yes.
and, you know, the stuff that, you know, I've been trying to get out to the masses for a long time.
Well, I have a lot of patients that are pretty darn sharp today, and they will ask these questions and very quickly will find out who they're going to go to and who they're not going to go to.
Yeah, but let's face it, the truth is, you know, you are mostly still in the hair world. And the hair loss consumers now and for a long time have had resources that we've developed that they can go to where they can find the truth.
Thank God.
That doesn't, well, thanks, but that doesn't necessarily, I mean, there are some decent resources out there for the other side of cosmetic surgery, but I have to tell you, it's still the Wild West. And when I go online and I look at some of these websites, I'm like, holy cow. I mean, they're just marketing machines, and they're not really providing consumers with accurate information, in my view.
Well, I think we need to be proactive with the consumers and say, look, you got to ask these basic questions, and no matter who you go to, no matter what they have on their website, have them explain what it does, and also have them produce one or two published papers on the procedure that they're offering you. Because if they can't do that and they can't explain it to you, that's a red flag.
Yeah.